Hi, I'm Dr. Greg Castello, board certified family practice with CastelloWellness.com, and I'm going to talk today about why benzodiazepines like Valium, Xanax, and Klonopin are bad drugs in general for chronic use. They are very much like alcohol in their effects. They are addictive, habit-forming, and the withdrawal from them can be life-threatening if done abruptly. So the only two types of drugs that are life-threatening to withdraw from are alcohol and benzodiazepine. So when someone's an alcoholic and they drink a fifth of vodka a day, they develop a tolerance, number one, so they don't start by drinking a fifth, so they drink more over time with less effect. But if they stop abruptly, they go into DTs, can have seizures, and actually die from withdrawal from alcohol. So if you're an alcoholic and you go into withdrawal, we actually put you in the hospital for that. Other drugs, cocaine, heroin, crystal meth, although they're uncomfortable to withdraw from, they are not life-threatening, and oftentimes your insurance will not allow you to be admitted because they know you're not going to die from withdrawal. Benzodiazepines, Valium, Xanax, Klonopin are like alcohol so much that if you take them on a regular basis, if you stop them abruptly, you go into DTs or withdrawal with shaking, racing heart, elevated temperature. You can develop seizures and you can die. So as far as your brain is concerned, they are almost interchangeable to the point where if an alcoholic is admitted to the hospital, we actually put them on high-dose Valium to replace their alcohol addiction and then slowly withdraw them from the Valium by giving them a smaller dose and giving them less frequent doses. So a normal Valium dose is 5 or maybe 10 milligrams every 6 hours. An alcoholic in the hospital can take 20 milligrams every hour and still be shaking and trembling from withdrawal because they have such a high tolerance to the medication. If you take the drugs occasionally, that's not a big deal, but if you take them on a regular basis, that can be when you become addicted to them without even knowing it. I don't like the drugs as a sleep agent because of this addiction. There are other medications that we can use that are not addictive. It is an excellent anxiety drug. I don't argue that point, and when you take it, you usually feel better within 15 or 20 minutes, so it's a very powerful drug, and it is very easy to get used to the effects because they are so good. So if you have chronic anxiety, you should be on some other type of a medication as a daily preventative and use your benzodiazepine as a breakthrough or emergency drug. If you are taking it for sleep, you should talk to your doctor about putting you on something else for sleep and saving it for just anxiety purposes as well. So be careful when you get a prescription for Xanax. It is very much like alcohol. So if you went to the doctor and said, I have anxiety, and the doctor said, take a shot of whiskey twice a day as needed for anxiety, that's almost exactly what Xanax prescription is, except it is a pill from the pharmacy coming from the doctor, so it does not have that stigma. In fact, many alcoholics in the bar are self-medicating for anxiety issues with alcohol because they figured out a long time ago that when they take a drink, their anxiety gets better, and they use alcohol like a drug. So benzodiazepines, Klonopin, Xanax, Valium, diazepam, alprazolam, clonazepam, temazepam. If it ends in a PAM, then it's a benzodiazepine medication. So talk to your doctor if you are taking them on a regular basis. Don't stop them abruptly for the risk of having withdrawal symptoms. Dr. Castello, thanks.